Hi, PJ Scott here, your Navy Waves veteran, Vietnam era. Thank you for joining us on Veterans Forum magazine. Now, as most of my viewers know, I'm very active in American Legion, the Blinded Veterans Association, and Disabled American Veterans. And today I have a great guest who I kind of think is the daddy of all of us vision impaired, legally blind, and totally blind veterans, Walt Werkoven, who is the VIST Coordinator. That stands for Vision Impairment Service Team. Welcome, Walt, to Veterans Forum magazine.
Thank you, PJ. It's good to be here.
Now, what does your job, because you've had this job for quite some time, and I'm sure it's went through many evolutions, but basically give us in a nutshell, what does a VIST coordinator do?
I like to say that I'm a high-priced red tape cutter. I'm a blinded veteran's best friend because I work to help get through the whole morass of the system.
And I can vouch for that. He is excellent in that.
There's just a lot of things that have the high potential of going south. And so we try to help people to get through the system, to get them the services they need. And what does a VIST coordinator do is a great question. It's basically they start with case management. And I work with people, and I have worked with some of my veterans for 35 years. I've known them for a long time. As we say, we were both young then, and we continue to work and we continue to work with them until they either pass away or I retire. So it's a really interesting experience because you really get to know people, get to know their families, get to see them go through life. And, we try to also, a major thing we do is to get them the appropriate services within the Department of Veterans Affairs. And the appropriate services can include such things as blind rehab skills training at a blind rehab center. It can include a referral to our blind rehab outpatient specialist who comes to the home and trains people and evaluates people in their home environment. It can include, and a major emphasis that I've been working with in the past few years, getting people involved in primary care, getting them to come into the facility and get their health care done, because what we'd like to do is see every veteran, if possible, have a primary care provider, that the old family doctor kind of thing, that knows the veteran, knows their physical and psychological needs, and can then appropriately treat or send to specialty clinics as they need to.
So this is really kind of a holistic approach, and may I add that they also can provide you with some great magnification devices. I am not totally blind. I've had 20 lasers on my eyes, and I see like a periscope on a sub, and my vision actually fluctuates. The great thing about living in Western Washington is usually it's so cloudy, I don't need to use the cane. Double sunglasses, a hat, and I'm good to go. So yes, that's a vital for blinded vets. And these services are available to veterans who have visual difficulties, even though that vision loss had absolutely nothing to do with your service time. For me, it was service time. But there's many vets, all vets, regardless of if they're service-connected disabled, have a visual problem, you're going to be a big daddy for them. And let me tell you, when you can't drive and you can't read the small print, you need this man. You really do.
Well, I think it's important. You need to have a good discharge. A good discharge. And if you have that, then we can help you. And we can get you into the system. It's a 3-page form. Your DD-214, and if you have vision problems and have a statement from the doctor, that will help us, because if you are in fact legally blind or close to it, we probably can give you some enhanced eligibility that takes away the need to deal with the means test. Because the means test can be something that prevents people from getting service if they have an excessive estate.
Now, over the years, policies change, and you wanted to make a point to give us some exciting new information for vision impaired, blinded vets, and so forth. So tell us about that.
Sure. Well, if you want to have a number, it's Public Law 111-163. And with that, you can get, and $1, you can get a small cup of coffee at McDonald's. But what this came from was a Veterans Health Care Eligibility Reform Act. And on May 5 of 2010, the President signed this, which meant that catastrophically disabled veterans no longer need to pay for their health care, both inpatient and outpatient, and inpatient and outpatient medication. It's a really critical change in the past. I'm going to tell you in the last 15, 20 years, it's the biggest single thing that's affected me professionally, because it's allowed us to treat people without having to deal with the issue of income and without having to develop a service-connected claim for someone if their income was in excess of what was accepted in the means test. So it's been a huge boon. It's created quite a bit of paperwork, but we can do it. And this morning I did 2 of them, for example. So it's not terribly difficult, but it does require someone to do it. And that's part of what I do.
Yeah, that's a great benefit to the vets. So let me make sure this is clear. Of course, I'm service-connected disabled. This is for those that are service-connected or not?
Correct.
Or there's such a long time to establish service-connected disability. Believe me, I didn't get mine overnight, but that's too long a story to get into. And so they're not just left out there hanging in the wind.
What this means, PJ, is this. There are many men and women who fought for their country. They got out of the service. They developed a career. They developed savings. They did all of those things. And when they're age 80, they developed an age-related disease called macular degeneration. Because their savings was in excess of $80,000, we couldn't treat them, and it was awful. People that had fought for our country and had done so much, we lost the ability to help them. And so with this, we don't have to deal with the issue of income. All we have to do is deal with the issue of a good discharge and the disability. And it's really, really wonderful, because you really can help people, you really can make a difference in their lives. And a lot of our diseases, you mentioned service-connected versus non-service-connected. Probably the majority of people that we see have macular disease, and macular disease is an age-related disease.
Right.
And you know, many of our people are well up in years.
Right.
And they've not used the VA until they're, say, 80, 85 years old.
Right, right. And this bill, again, repeat the number for people again.
111-163.
And that refers to catastrophic, which is not necessarily blindness.
Correct.
Let's make that really clear.
Blindness is one of them.
Sure.
Paralysis is another one.
Right.
And there are other things that can be cumulatively used to develop this. It takes a lot more effort. For me, the only one that I use is the blindness, and they have to have a certain diagnostic code, and in the 369 series, to be specific. And if they got that, then we can help them, and we will help them.
Okay, now there is a VIST coordinator at every Veterans Hospital, correct?
That is correct. Not all of them are full-time, but we have full-time in this region, in Boise, Spokane, Walla Walla, Tacoma, Seattle, in Portland, and those are all full-time VIST coordinators.
Right.
And we have part-times in Roseburg and White City. I know you reach into California, we have many full-time coordinators down in there
Right.
too. So we have I think about 170 VIST coordinators in the country, of which well over 100 are full-time.
Now remember, VIST is the Vision Impairment Service Team Coordinator. Now this is going to be seen all over the Northwest and California on TV, but this is also going to end up being on YouTube with the capacity of millions of people. A vet has a catastrophic injury, or maybe a son or a daughter has a World War I or Korean War vet. Who exactly do they ask for when they pick up the phone and call their nearest VA hospital? Who do they need to connect with?
If they don't have anybody they could think of, I would call social work service at the local VA hospital and say, I want to talk to the person who works with the blind. And then they could assist, should be able to assist, and get you to the help you need. If people called me, I would be very happy to help them, and I would put together a service there. The Blinded Veterans Association, whom you belong to,
Yes.
that's an organization that deeply cares about blinded veterans, and they will, in fact, help line up someone to assist this person wherever they happen to live in this continental 48.
Now, is there some kind of web page or something they could go to for that?
For the BVA or for the VA?
Well, to get this information about how to hook up themselves or their dad or their uncle or whoever to get this information.
Well, Blinded Veterans Association has a well-documented web page. I'm sure that if you go into Google and look up Department of Veterans Affairs blind, you will get more information than you'll ever be able to use. But basically, you want to look for the specialist who knows blinded veterans in each facility, and that happens. Every facility has someone. Some people are more experienced than others.
Right. Well, folks, check this out, because this can save you enormous money. And I know when you don't have cash coming in, oh, that can affect your psychology just horrifically when you don't know where your next dollar is coming from. So if you are catastrophically injured, know someone that is, please do the research and get the information. Tremendous help to your vet. Walt, we're out of time. I want to thank you so much, and God bless you for helping so many blinded veterans in the Western Washington area. This is PJ Scott. Thank you for joining us.